on behalf of all racial and ethnic minorities. We are so honored to have a dynamic guest for today's webinar. Marcia Jones is a Texas native. She's a co-founder and executive director of the Afia Center. She holds a bachelor's degree in psychology and is a graduate of the Black AIDS Institute, African American, HIV University, and Tyndale Theology School. Marcia is a national grassroots organizer. She's a community mobilizer, a professional speaker, and health educator with a commitment to transforming women and girls' lives. Please welcome Marcia Jones.
Hello, everybody. I'm really happy to be here, and the Afia Center, we are extremely excited to be sharing this opportunity with Mblanka. I've always really held this organization to a high esteem, especially the work that I've watched See Virginia do over years and years, especially in the HIV community. It was just always refreshing to me to see this Black woman leading the way in that work. And so this is really an exciting opportunity for us. And so I'm excited to be here. Along with me today, I will be here speaking, addressing the questions that will be asked. And Deandra Willis will be a part of this conversation. She's one of our doulas. She really moved our doula work forward. We have 2 other doulas, but Deandra will be speaking on behalf of our doulas. She's one of our mamas, and she's highlighted in our report. And she's going to be a mama again, and she's also an active doula. And so she's had some experiences over this last couple of weeks in this COVID moment crisis with some really horrific experiences that mamas are having right now, especially Black mamas. So she will be bringing that perspective, and our policy director will be here with us today. I would say pastor, maybe I'm speaking something. Reverend Deneen Robinson. Deneen's been around for a long time. She's in this RJ work with us now, but she have a very extensive history and amazing work. She's written articles, been featured. She's traveled around the world doing work to end the disparities that existed among HIV among Black women. She's worked in research, just in many areas, and now she's leading our policy work. And so Deneen will, they'll tell you more about themselves, but Deneen will give some policy, some policies that we've tried to get moved that would have been very beneficial. And also, how do we use this time to push for better policy right now? Because we know when there's pressure will always show you where there's a leak or where there's a weakness. And at this time, this will be the perfect opportunity for us to see exactly more than what we ever knew before that's happening with Black maternal mortality. And hopefully we can get the kind of policy moving forward that in a crisis or out of a crisis, Black mamas will not keep experiencing what they're experiencing. So that's just a part of the Afia Center. And so this is what we're gonna bring y'all today. So we're ready. Am I waiting for?
No, go ahead, Marcia.
Okay, so do you just want me to go on with the questions and just go from there so nobody's going to ask me a question?
I mean, you could go on with your, what you're presenting today, and then we'll take Q&A at the end.
Okay, well, that's what we're going to do. So one of the things I wanted that I was going to talk about today, I was going to talk about why it is so important now more than ever that during this COVID crisis that we are talking about Black maternal mortality, talking about maternal mortality, but specifically talking about Black women right now. And we will be talking a lot about what's happening in the state of Texas because that's where we do our work. We do work with people outside of Texas, but our work, and you will see that when people look at our report, our report is very specific to what is happening in this state. And there's some back and forth on who have the highest number. Sometimes you may hear somebody say Atlanta have the highest number. Sometimes you may hear people say Texas have the highest numbers. But the thing is, I don't even like to talk about who have the highest numbers. What I like to talk about is the fact that those numbers are so alarmingly high. And so right now, it is very important to talk about that because like I was saying a minute ago, is that when pressure is here, then you see really where folk are hurting. So at a time like this, even during a pandemic, so one thing we know, even during a crisis, even during a pandemic, life still happens. Folks still get pregnant, babies are still coming, and we want for life to still happen, even at a time like this. So, but the thing is, whatever was happening prior to the crisis is going to be exacerbated by the crisis. So if Black mamas were already dying at too high of a rate prior to this pandemic, and over the last couple of weeks, there has been an alarm being rang that Black folk are carrying the burden of disease as well as death. So we are carrying the highest burden of mortality as well as morbidity within this COVID crisis. Then that's also going to find its way when you're talking about Black mothers. It's not going to look a lot differently. And so we want to make sure that Black mothers are being lifted up at this time, because as resources start to happen, as different things start to happen, we have to make sure that Black mothers are being covered in this. We cannot allow for Black women or Black mothers or whomever it is having Black babies to just be a sidebar to this conversation. We cannot stop talking about Black mothers at a time such as this, because this is going to be a most crucial time for the lives of Black women having babies. There's already this lack of access to health care in the state of Texas. In Dallas and North Texas, we have about right at 3 million people in North Texas. And the Afia Center is located in North Texas. And in North Texas, a fourth of the people living in North Texas are not insured. That number is represented very highly by Black women. We were not successful in moving legislation in our last legislative session to expand Medicare for folk who are having babies. And so that's a large amount of folk who, while they may have care right now, may not necessarily have care as they go through. We don't know how long this is going to go on. And so that's an added worry. And so it is important that we're talking about this. These are the women who are, for the better part, are going to be what we deem essential workers right now, but also going to be the folk who are making the least amount of money. So these are low wage earning folk. But we don't want to forget also, one of the things that we're seeing in Dallas is that there's a lot of high numbers of COVID in the suburbs. So that means that not only are the women in the inner city going to be impacted by this, but also the women who are living in the areas where there's a higher economic bar. So people in the suburbs are making more money. They have more access, but we know that money and access don't necessarily curb maternal mortality. So even women who have more access are still likely to succumb to maternal mortality, because we know that race is a strong determining factor when you're talking about maternal mortality. So there are so many things that have to happen now. So we cannot take the pressure off at this time. Maternal mortality should stay in the front of this conversation as much as we're talking about COVID, because there is no real difference there, because it is being Black folk are carrying a greater burden just simply because we are Black. That is the same thing that we look at when we're talking about maternal mortality. And in Texas, there's not enough people who look like the people who are dying talking about people are dying. We still almost stand alone in this work in Texas. Yes, there's a lot of people who work for hospitals who may look like us. Yes, there's a lot of people who may work for some agencies that look like us. But there is not a really hard push on maternal mortality and what that looked like in this state by people who look like that. There's an amazing group of people who do this work in Austin, and then there's the people who do this work here in Dallas, and maybe in Houston. But as you see, it's very segmented. But so we have to keep ringing the alarm. We cannot let Black women and Black mamas, whoever it is having Black babies, get left out in this conversation. As it relates to healthcare, and I'm going to go really quickly. I mean, as it relates to why this is so important in the South, many of the governors or the elected officials in the South are usually Republicans or whatever. They're usually very conservative. And so that history of conservatism have never served Black people. And so there's less likely that the needs of these people are going to be met under these current administrations. And people will continue to always be politicized. And so when you're politicizing folk, the most vulnerable folk are going to hit it the hardest. And so just like HIV, just like many other things, people in the South suffer the greatest from many of these things. So in the South, you have these same people who fight equally as hard to make sure that there's dismantling of any types of unions or whatever that support folk in making living wages. They will fight equally as hard to end any efforts towards making sure that people have that people are making living wages. Right now, in the midst of this crisis, there was the city of Dallas is fighting to maintain paid time off. In the midst of a crisis, there's been an injunction against policy that we thought we won to make sure that people had paid time off. These are the kind of things that you are faced with when you are in the South at a greater rate than most other people. And the South is the hub of most health disparities that impact Black folk. That don't change with maternal mortality. That's why come on Monday, Texas can have the highest rate of maternal mortality, and on Tuesday, Atlanta can have the highest rate of maternal mortality. And if you're not careful, Wednesday, Louisiana will be able to boast, and then the next day, Alabama will be able to boast. Because here's the thing, when you're in the South, it really don't matter if you're in Texas, Louisiana, Mississippi, Alabama, all of those things, because of the political climate, very conservative political climate that still controls these states. Because even if the governor is a Democrat or more liberal, then those cities, those major cities, probably have folk who are not. So it is the politicizing of folk in these places that continue to keep us at these higher rates. And then the last thing that I'll say is that the impact, the mental impact that this will have on people, and this is going to segue over to Deandra, is going to be like, we won't be able to measure it because there's already, so even though we are not talking about maternal mortality nearly as much as we need to, we're talking about it enough to have people fearful of going into those systems. So prior to this crisis, maternal mortality, or the thought of having a baby, as much as you were excited about it, being Black meant that you also had to have some feelings of trepidation, because you very likely can die from it. And so now we're in a situation where you may be in a community where there's high community spread of this disease. You're hearing that it is happening to help people in the healthcare system themselves are sick, working in really bad conditions without enough access to the things that should keep both them safe and you safe. Then you're going to go into these systems without your care team, because there's nothing consistent across in the city of Dallas or the state of Texas. Every hospital is playing the game by their own rules. Some hospitals you can bring somebody with you, some hospitals you can't. That you have prepared to have this baby for the last few months with not just your husband or not just your whoever your person is with you, but your entire team, which includes your doula. That doula may not have access like they had. And then I was on a call a couple of weeks ago whereby which the midwife may not have the same access that the midwife used to have. This is very important because the data has shown us that midwifery and doula increases the likelihood of decreasing maternal mortality and infant mortality among Black moms. So it is important that these traditional ways of birthing remain in place, and that is not necessarily there right now because mom don't know who's going to be there with her. And she now has to choose. And she's not trusting the system that's got to take care of her. And so this means this is mental health stuff that can happen. This is also physical stuff, high blood pressure, all of these things where there was not an issue before. So these last few months, that should be like these times of expectation, great expectation, is filled with trepidation. The closer it is time to get to the hospital, the more stress, the more pain that moms are feeling right now, because there's not an assuredness there that they know that things are going to work out the way that they want them to. Birth plan, like that's, will it even be able to happen that way? So those are the things that I wanted to talk about, but also we want to make sure that that you guys know that I'm not just talking just to talk. We have data to support the feelings that I have about this. And these are not just my feelings. These are real, actual things that we are faced with. And one of our doulas is on here now, Deandra's here, and she's going to talk about the challenges of trying to provide birth support virtually, and some of the things that can jump in the way of that, and also her own experience, because her next child is due in the heart of this crisis that we're facing right now. And so what is that going to mean? So that's my Easter speech, y'all.
Good morning.
I hope that I covered everything that I had on the bullet points that I was going to cover. And Deandra will be speaking with us now from the AFIA Center, Southern Roots Doulas.
Good morning. Again, I'm Deandra. I'm one of the doulas for Southern Roots Doula Services. Y'all see me looking down because I have my little one right here, trying to make sure you don't fall out the seat. But as you were saying, I've been a doula for now going on 3 years. And I have, in this time now, found that my doula services are challenged because of the pandemic that we have going on. I had one mother here recently who, been talking to her from the start of when she found out she was pregnant to her having her baby on Sunday, and finding myself having to virtually doula her, and found that extremely challenging because after about 3 centimeters, she can't talk to me anymore. She did have her husband with her. But the whole role of a doula is to be there from the start of when you finding out to 6 to 8 weeks after you have your baby. And, that was our plan, was to be there for her from start to finish. And we was there from start to 3 centimeters. And after that, it was, I had my baby. A few other women that have been reaching out here lately because they are expecting soon. And they found that some of their providers have canceled their appointments, which is a big risk. Having to change the policies at the hospital. So everyone has different policies, like Ms. Marcia was saying. Everyone have their own, I guess, mandating rule for their hospital. So either you can have one person that has to be there from start to finish. If they leave the room, if they go to the pod, if they go to the vending machine, they can't no longer come back into the room. Some people can't have anybody with them. And so it makes mom have to choose between their doula support and a family member support. Just kind of speaking on my experience, I'm 5.5 months pregnant. And my plan is to have a home birth, which I've been knowing since I found out that I wanted. Well, before I found out, I knew I wanted my next one to be a home birth. But some of the fears and anxiety that I face with being 5.5 months pregnant is the fear of, catching COVID. I'm also a hairstylist. So as you know, if people are following the Texas unemployment rate, which is a joke, well, I'm really, so I'm just gonna say how I feel. It's a joke. So being a hairstylist, you're pretty much independent. And so that leaves you with either you're working to get money or you're not working and you don't make money. I have 2 other little ones. So I find myself like having to make the decision sometime. Well, not anymore, but at first was to, if I need to provide for my family, then I have to go work. And so I'm real sensitive to other women that are expecting or that's not expecting that, they have to pretty much find themselves at risk to take care of their family. And so I think about those things with me being pregnant now, like scared to go out, scared to go to the mailbox or anything like that, because even though I'm having my baby at home, I could very well get sick, and then all my birthing plans that I have been planning all this time is out the window. And then to go to the hospital, you have anxiety of, well, will I have anyone there with me? Will I be able to push naturally like I want to? Will they make me have a C-section? Because the reality of it is every hospital is different. I've been doing a lot of research and a lot of communicating with different doulas from everywhere, really the South. And they're saying like some hospitals make you come in getting an epidural, like you have no choice because they're already planning your C-section. You could have a perfect pregnancy, no issues, but we all know that with that C-section, it's going to be other issues that mommies are faced with. With that C-section, you're not going to be able to see your baby. You won't be able to have that first connection with them with skin to skin or that breastfeeding. So it's gonna play a big factor into that bonding with the baby. And from there, we know that breast milk is some of the best things, especially for a newborn. Like they need that, and it's gonna, pretty much protect them. So if moms are getting that taken away from them, getting their birth plan taken away from them, everything that they thought that they would have had and had control of their birth, it is now snatched from them. So I think about that all the time, and I think about that when I'm, being with my clients and talking with them. Some of me and the other doulas talked about, when the pandemic started, like, okay, we're going to have to do virtual since the world has become virtual. And I found myself this weekend, Monday, when we talked, I was like, y'all, this virtual stuff is out the door. Because the whole part of being a doula is to be there by their side, to support them. And we're pretty much taking their attention away from them delivering and breathing through contractions by messaging them. And, you can't talk to the doctor because doctors are going to tell them pretty much what best fits the doctor and I guess your safety. So, if it's ways that we can stretch the mom and, meditate with the mom to get them through contractions, but the doctor's like, okay, we have a 12-hour turnaround on this bed. We need you to have this baby. Guess who's going to win at that time? That doctor, And so some moms feel disappointed and, they feel bad when they don't have the birth of their choice. And it's hard enough as a Black doula, I'll say, it's hard enough now that we have to always fight between medical staff and what we know that, can happen, what we know will work. So for me to be at home, Facebooking through Messenger, telling her what she can and cannot do, and the doctor telling her, no, ma'am, we're not doing that. You're going to have that baby by noon. You're going to have this epidural at a half a centimeter. You're going to be a half centimeter dilated. You're going to have this epidural because they already know you're going to have a C-section. We're going to turn you around and get you out of here and it's more money. But that gives her a higher chance of maternal mortality also. So it's very stressful. And every day I'm trying to find ways to be there for moms, trying to find ways. And it's disheartening because it makes me think about when my turn comes in July. Even with my midwife, she's now virtual. And we both realized last week that that's not going to work for us. I need her there because I need to have her in my presence. And not only that, but you know, during your prenatal care visits, you do your blood pressure, you do your all your urine samples. Well, if I don't have access to any of that, which I don't, then that means my blood pressure won't be checked, my urine won't be checked. If I have high diabetes or hypertension or anything like that, we won't know. And it's really me taking a risk of how I feel at the moment. Maybe I need to call 911 because everything has become virtual. So it's very important that our midwives and our doula have the access that they need to be there with their clients. And I know probably towards the end of the year, beginning of 2021, we're going to have a lot of people having babies, having home births, and going back to a natural way. And we will need that help and that support because it is hard, and especially hard in the South because a lot of people, you know, not always on the bandwagon of midwifery care. But we know just from facts and data that that's where it's at. It's always worked, and it's going to work, and it's going to get, you know, it's going to actually lower the rate for Black maternal mortality. So that's all I have.
Thank you, ladies. So I guess we can open it up for questions. Is that okay with you, Marcia and Deandra?
I'm sorry, I was trying to unmute. If we could give Deneen about 5-7 minutes or so to get us some policy, to just give some updates on some of the policy that we've been working on, that would be so appreciative, and then we can be ready for questions.
Sure, go ahead.
Good afternoon, everyone. First, I want to say that I am especially glad to be here. There have been a number of questions in the chat that I think are amazing, and I am going to speak to those now. Should I not answer them, then please put them in the chat again, and as we're doing Q&A, we can speak to the questions that you have. So, as the policy director for the AFIA Center, one of the things that I have been fortunate to be able to do is to engage with our legislators, community activists using C3 language to provide education around why maternal mortality is an issue for us as Black folk. Because it not only has an impact on the mother or the birthing person, but it also has an impact on the larger community. We know in the state of Texas, and our statistics somewhat mirror those of the U.S., Black birthing people are 2 to 3 times more likely to die while they are pregnant and within a year after. There are some specific leading causes of maternal mortality, hypertension, preeclampsia, the person developing diabetes in utero while they're pregnant, and then also substance use. Interestingly, cardiovascular related issues seem to be leading that pack. And we often say that Black folk are preconditioned to diabetes and hypertension. One of the unique factors, however, is the stress of pregnancy is compounded because of the systemic racism that Black folk experience. So it is not the preconditioning that is the major factor. It is the systemic racism and the bias that person experiences as they're going through the birthing process and as they are engaging with the healthcare system. We know this because there have been researchers looking at why this is such a phenomenon, if you will. And some of the things that they've come up with is a term called weathering. And weathering essentially is wear and tear on the internal parts. You know, we are infamous for saying Black doesn't crack, and externally that's true. However, we have a lineage of cracks, if you will, as it relates to our stamina of our heart, as it relates to the stamina of our organs internally. We've inherited these cracks. that become more pronounced as one engages with folk who are constantly reminding you or trying to convince you of your value external of yourself. As you have engagement with systems who treat you as if you are less significant than your white counterpart. And so the stress of those things, even as the data suggests that your income, access to health care, privilege is not something that exempts you from the wear and tear of weathering and systemic racism and ultimately maternal mortality. The risks are the same no matter what your access is. And we know that from watching what happened with Serena as she was trying to have her baby. She experienced the same kinds of things as other Black folk experience when they are engaging with our healthcare system. And so I want to set that aside, because one of the things that can happen is we put in place, well, I have insurance, so that's not going to happen to me. Well, I'm here to tell you that after having had the opportunity to research and even speak with family members of folk who have been lost due to maternal mortality, it's your resources are of ill effect in this particular situation. Some of the things that we have been able to do because of that is begin to look at implicit bias trainings for physicians and other healthcare workers. We have seen data from California that suggests that this is something that does not only help, but can help Black folk as they encounter the medical system, particularly as it relates to pregnancy, support them in getting the care that they need. We have also found that because of the cardiovascular issues that happen while pregnant, according to physicians, a person needs at least a year of follow-up. Well, if you are receiving Medicaid and even some insurance plans, you're not able to get that consistent year follow-up after pregnancy. And so what we have done is provide education and work with policymakers to get Medicaid extended in the state of Texas and partner with organizations to get Medicaid extended in the US. We have had some success here in Texas. During our last legislative session, we were able to get legislation passed on the House side to extend Medicaid to 12 months. However, because of because of the political system and the politics around Medicaid expansion in Texas, the mostly Republican-led Senate would not even pick it up. And the policymakers that had historically, the Republican policymakers, let me make that clear, in our Senate who had historically sponsored maternal mortality legislation would not pick the legislation up because they said if they supported it, they would risk losing support of the party. So it's not about whether we know that maternal mortality and Medicaid expansion go hand in hand. It is people are prioritizing party lines over people. And most of these Republican politicians have support areas of the state that are in some way rural, and rural hospitals are being closed at such rapid rates, or they're being taken over by Catholic systems, which if you're not a person of faith or you don't subscribe to their birthing policies according to the church, then you still aren't able to get the care that you need in those systems. The third thing that I want to share is this is an issue for us because our birthing, our loss of Black women to maternal mortality is akin to the rates of third world countries. And we know that more than 70% of these deaths don't have to happen. They happen simply because of the care that people are not receiving. They're not being listened to. Their ways of engaging with the system are not being supported or respected. They're being forced to have cesareans because the provider wants to go golfing, or it's a Saturday, or it's a health crisis, so we need the bed. And so those are some of the things that I want to lift up. And someone asked the question, does being a teenage mom put you more at risk for experiencing maternal mortality than an older mom? So here's the thing. For Black folk, the researchers say that we should start preparing our wombs in our late teens, early 20s for birth at the end of our 20s because of how our wombs are impacted by weathering. So absolutely, having a birth as a teenager, as a Black teen, would increase your risk on top of the already increased risk because your womb hasn't fully developed yet. And so it's less about the age than it is about the timing of how things develop internally. And that is compacted as a Black youth because of the systemic racism and that impact on the body. That's also true for older Black women as well. So it's not one or the other. It's both ends in terms of age where there is a greater risk. But that doesn't mean that you can't have a kid. That just means that you need to have folk that support you and can provide you with the things that you need so that you can have a successful delivery.
Thank you, Deneen. That was great. Thank you, Deneen. Thank you, Deandra. So I guess we're ready for questions now. There is a question in the box though for, I saw a couple of questions, but there was a question in the box for you, Deandra. Thank you, Deneen, for answering the question on teenage mothers. It says, I'm due next month. My husband is the only one allowed in the room with my midwife, and he's very nervous because we had mom and sister with us for our other two. Do you have any reading material or a website I can have him look at that may help?
Yes, because I actually have my husband. Same thing. It's on Facebook. If you look up Doula Dad, they're having a webinar this Friday. I think it's at 1 p.m. I think that'll be really good. I have looked at one of their webinars, and it pretty much gets the dad ready for how to support you. And I think that's really, really important. It's called Doula Dad. Just look it up on Facebook and join the webinar. Maybe I'll see you on there also.
There was a question here. Oh gosh, I'm gone, y'all, but I'll be back. There's a question here about PPE for midwives and doulas. Absolutely, PPE is important for midwives and doulas. There's so much that we don't know about COVID. And so we want to make sure that everybody is safe. We want to make sure that moms are safe, families are safe, midwives are safe, doulas are safe, folk are going back home to their families, folk are coming into houses with families. And so that's very important. But I think one of the bigger questions to that would be, will the government or will these healthcare systems be invested in providing birth workers with PPE? Birth workers who are doing traditional birth work outside of a hospital setting. I think that is one of the things that I hadn't even thought about it that way, that really should be lifted up, because seemingly PPE is a challenge for everybody. So I think that having that conversation with local legislators and folk like that, hospitals, making sure that folk who are doing birth work outside of a hospital system have that same access. Because if the birth workers have access to this, that lowers the chance of them exposing the mom or the families, or the birthing folk, that birthing folk family. And it also lowers the risk of that birthing family exposing the birth workers, because people are going to be going out of these different spaces. So yes, I think that it is just so important that birth workers have access to the same protective materials that someone that's working inside of the healthcare system, because they are just as vital to the importance of a life as the folk that we identify as first line folk. These people are also first liners because they're there with them. And someone asked, how do we strengthen and support the importance or the roles of that traditional birthing in the system? I think that and I, Deneen, you can answer this one too. I think, and Deandra, I think that there's a couple of things there. I think one, they've got to trust us. I mean, like there's a thing that says trust Black women, because we're talking about Black women today. Trust Black women. We know there's a whole history of Black midwifery. And there are Black midwives, if you do history on them, who birthed thousands of babies and never lost one. Never lost one. So trust the women who are doing this to do the work that they're doing, and invest in these communities. Invest the money, because we cannot do it without resources. So there have to be real investments. The Black Mamas Matter Alliance, which the Afia Center we are part of, they're doing some really important work. They're collecting data. They are working with legislators. We are working with ways to make sure that there are resources in place to make sure that people are being trained to be doulas. People are getting, I think that, and I'm not talking about Black Mamas Matter Association now, Alliance now, I'm talking about in general. I think there is still a disconnect or a miss around the training of midwives and midwifery, because it is very much still controlled by white midwives. And so even when Black midwives are they're getting their trainings done, there's still some challenges with getting people to be your preceptors and things like that. So I do think that the education system need to be opened up wider, where folk can go to school to be midwives. It is more accessible, getting government grants, being able to do this, because it is a very expensive undertaking. And so people have to be financially able to do this. So I think that resources is really huge, and trusting the people in your community to do the work that you're doing. I know that's some work that we're looking at the Afia Center now. We are in the process right now of looking at opening up a birthing center in the southern sector of Dallas, where it is most needed, so that the folk who don't even know that this was an option for them, it will be there. And being able to do this without these exorbitant costs that's connected to it.
Marcia, there's a question from one of the participants wanting to know a little bit about living with HIV and birthing during COVID-19.
Wow, we should have had our other doula on here.
Right.
Because I would say, talking about, I just actually text somebody, a journalist inside of the thing. I was texting her talking about
She's the one that asked the question.
Okay, like we need to have some conversations about this. I think that is very important, because there's so many things that's happening in HIV right now, whereby which there's absolutely no reason that mamas or folk are not getting pregnant. People have access to health care. There are HIV drugs, medications, which means that puts them at risk of not infecting anybody else with HIV. So the bottom line is that folk gonna be able to have babies the old-fashioned fun way, which means that there's gonna be some more babies. But we also have this thing around stigma that still sits in the way of how people live through the world. So I think that there's gonna be, stigma is gonna look different for folk living with HIV coming in those places. I think implicit bias is really going to show and rear its ugly face in those places. I think that we've not had to have a whole, we've not had a whole, so now you're looking at people who were not exactly sure how they see themselves working with people living with HIV, working with Black folk, and now working with people living with HIV at a time when COVID can be a thing. So I think that we've really got to dig deep. I don't have the answers for that, but I think that we have really got to dig deep into that, because I have not seen that conversation happening nearly enough. Now, we've had a mom who was living with HIV who delivered prior to COVID. She had a very successful delivery. Our other doula who's in the line, her name is Helen Zimba, and she was that mom's doula, and it was an amazing experience. We were all super excited about it, because it literally was coming back to full circle, because Helen remember when that baby was a baby. So that was an amazing thing. But yeah, I don't think we're talking about the impact of HIV, not the condition, because folk are healthy. It is the stigma again that we're going to have to be faced with. It is the huge amount of stigma. And will mamas even come in because of this stigma? Do they want to live through that? And so I think at a time never before should we be increasing access to traditional birthing. Never before should we be increasing traditional out of hospital birthing now, so that we can make sure that women or folk living with HIV who's birthing will be able to do this stigma-free, and also be connected with all of the care that they need, with a really good working relationship with their infectious disease doctor, so that we know that everything will be okay. But the biggest piece to that, I don't think it's going to be actual health, because people living with HIV, they are as susceptible to it as anybody else. There's no difference in how we get it. It is the stigma that's going to impact it more than anything. It is the stigma. And by the way, at the Affairs Center, we specialize in being folk who are welcoming folk who are having babies living with HIV. We are excited every time we get a phone call from a woman.
Thank you. Another question came up. What can I tell a Black expectant mom whose doctor is pressuring her to have a C-section that is in good standing health-wise with all her current doctor's visit? She's due in August.
So there are two C-section questions. There's that one, and then there's also one from the person who asked the question around being a teenager and wanted to know what would be a process to put in place. And I think Deandra can offer some steps to that as well. But one of the things that we suggest in the maternal mortality report at the end, I encourage everyone to get it, and to read it, because I understand that they're going to send it to all the folks who registered for this webinar, is that you do your own research. You begin to have conversations with your provider about what you want, what your plan is, even in the presence of COVID. Just because your provider wants to pressure you to have a C-section, it is important that you stand your ground. And that's why having a doula and or a family member who can back you up is so important. There has to be someone outside of you that can support you in getting your needs met. Go ahead, Deandra.
Yeah, you kind of said exactly what I was going to say. If it was me as her doula, I would one with Southern Roots. One of the most important things that we try to emphasize is education. For childbirth and education, so that you know exactly what you're going to be doing, what your options are, and knowing how to confidently tell your doctor, like, no, that's not what I want. If it's no medical need, then you should be able to tell them. So it's all about your birth rights and justice, and knowing and being confident telling your doctor no. As a doula, if you comfortable with talking to your client and maybe keeping her home and having her to labor at home majority of that time. You can't do a C-section and you walking into a pushing. So, but yeah, it's just knowing your rights and being confident and letting her know you know, building your client up and letting her know, like, you don't have to if it's no medical reason. And don't be afraid to request paperwork, your charts, all of that, because you have the right to all that because it's yours. Listen.
Okay, thank you. Another question is, how do you suggest Black women find a midwife?
So, that is an interesting question. I was actually just about to go, because I was thinking somebody's going to ask that. And so I was going to go to Black Mamas Matter page to see if we have a resource there. Especially, you know, one of the ways of doing it, of course, like anything else, you can talk. So midwifery it's not as foreign as it seems. You can definitely talk to your obstetrician. You know, you can talk to your doctor. You can ask them. Many hospitals, large hospitals like UT Southwestern Medical Center, whatever, like in a metropolitan area, those hospitals will have resources for doulas. A lot of them have, midwives. A lot of them have midwives on staff. Now, that's a in-hospital midwife, but they have them. And they also have information on doulas. So while we're talking about this, it's not that they're just not there. It's just knowing. So I would start first with them, but I would go to Black Mamas Matter Alliance and look on their page and check. There will be resources there because so many of us are connected with Black Mamas Matter Alliance in some way. Like the Afia Center, we're like kindred. I want to make sure I'm saying it right. Kindred partners, right?
Yes, yes.
And so if something was happening in Dallas, if you lived in Dallas, they would be able to at least send you to us. And we would be able to take you from there. If something was happening in New York, you know, Ancient Songs Doulas would be able to assist you there. If something was happening in Austin. So many of us are a part of that network, and it's growing every day. They would be able, that would be a resource for you. But yeah, go to your hospital, your OBGYN, they have those resources. So you don't have to make it hard, and you don't have to limit it to a Facebook search. There
and
are
your
some
insurance.
ways. And thank you, Deandra. So I ain't having no babies. Deandra say your insurance. So it's there.
Okay, thank you. I think this might be the last question also, given the time. But someone asked, if someone wants to pursue becoming a doula in their community, what steps should they take? After attending this webinar, it seems as though we need to have more doulas in our community to help reduce the maternal mortality rate.
Answer that, Deandra.
So it will be really I hate to say Facebook, but Facebook is just, all the information is there. And so it's so many doula groups on Facebook, and I, you know, just start connecting with some of your local doulas and ask how they you know, got certified or what classes did they take. It's a lot of doulas now that does a certification. We got ours done through Ancient Songs, and so she's in New York and she came to Dallas to help us and certify us. So it's many ways, and I would say Facebook. Facebook is one of the biggest community groups. Y'all, it's nap time for him. So yeah, just being able to do that research on local doulas, and I'm sure you'll be able to find and connect with someone. You can connect with me on Facebook, and I can help you also.
And that's a good question. We're going to make sure that we put that link on our website so that folk can actually go to our website. At least we can give them resources within our range of what we have. So. Yeah, if there are no more, there literally can't be any more questions because we're at 12:57 here. So we're 3 minutes at the top of the hour.
So I have to ask all of those that have registered for this webinar that are panelists, please follow us via social media. We regularly share information on our Facebook page. On the Afia Center. Also, we have a doula page Our Southern Roots Doula Collective has their own Facebook page, and we share information via Instagram and Twitter. And for the person who was born on April the 7th, you rock, because that is my birthday. Your life is going to be amazing. The life of that baby is going to be amazing. I just want to put that out there. So, so if you do those two things for us, that would be awesome. And then also remember that those of you who will be, who are participants in this webinar, will be receiving our report. You will be receiving it via email. It's not very long, but it is packed with information, data, stories. Deandra's story actually kicks off the report. And so we wanted to make sure we use both qualitative and quantitative data in sharing the maternal mortality story in Texas. So please read it and commit to sharing information in there with at least 3 people that you love.
And I will close it with this. Birth work is the entire spectrum of reproductive health care. And it's important that we are supporting women on every juncture of this journey. So I want to close that with this. Not only are we supportive at the AFIA Center for women who are birthing, because we want to make sure that folk are birthing healthy and that folk are living and that babies are surviving, but we also want to make sure that we are supporting people who choose not to go full term in a pregnancy. That is just as important as supporting folk who choose to go full time in a pregnancy. And so, because at any piece of that, life lays in the balance. If women who are trying to access the necessary medical reproductive health care to end a pregnancy, that should happen, because if it's not done medically safe, that can have a life in the balance. For women who choose to go full term with a pregnancy, they need to have full access to quality, affordable, accessible health care throughout the pregnancy and throughout that lifespan. And it just shouldn't stop at the first 60 days after either a missed pregnancy or a full term. So just keep that in mind because we can use so much help in those areas, making sure that mamas are having access to this throughout the full spectrum of reproductive health care. It don't just start and stop at a pregnancy and ending at a birth. Sometimes it's disrupted in the middle. Sometimes it's a choice to disrupt it. Whatever that is, folk deserve dignity with their care, and they deserve access to that care. And nobody should be putting their life on the line in order to make a decision that they've deemed good for them. That's either birthing or ending birth.
Thank you so much, Marcia, Deandra, and Deneen. This has been a great webinar, very informative. And as I've stated earlier in the call, that we will be sharing the recorded webinar with all on our website as well as on the AFIA website. Again, thank you very much, and everyone have a safe and pleasant day.